Okay, welcome everybody. We're going to go ahead and get started here tonight. Thank you for joining us. We've added a few more participants since about 6 o'clock. So for those of you who just joined us since the last time I spoke, this is being recorded. It will be edited for time length and put out on our district website. So if you know of folks who are not able to join us tonight, but would absolutely want to learn more about this opportunity that we're bringing to Valley High School and West Des Moines seniors, they'll be able to access this recording. You'll see some contact names and information that'll be shared tonight. All of this will also be available and sent out. So if any moment you feel like you're not able to access that information at a later date, just contact the main office of Valley High School and we'll get you in contact with the right people. So just to get us going here tonight, my name is Shane Scott. I am the Director of Secondary Curriculum for West Des Moines Community Schools. We are here tonight to talk about emergency medical or EMT course program that in partnership with the City of West Des Moines EMS Services and DMACC, we're really proud and honored to have this opportunity to engage in this partnership and bring this opportunity to all the students who will be seniors next year at Valley High School. So we have a few slides of information that I'm going to share with you just to kind of guide our conversation. By all means, I'm not going to try to pronounce every one of these gentlemen's names, but different folks will come up and speak and kind of share different bits of information. But if at a later time, any of these folks or someone that you want to connect with, they'll learn a little bit more, by all means, reach out to these folks and they'll help you get you the information that you need. So one of the things I think is important to highlight is why EMT for West Des Moines Community Schools. So I got 3 things that are bulleted there. I think they're kind of self-explanatory. The job market need for health sciences is in very high demand. We've recognized that here in West Des Moines and at Valley High School. Going on at least 2 years now, we've had a very strong CNA program. We've had a waiting list for that. We know that the healthcare community and the healthcare job field continues to grow with very high demand. The job market's strong, there's livable wage jobs, and there's really clear career pathways that you're going to learn a little bit more about tonight. So these are those entry opportunities and entry points. You certainly don't have to go straight off the 4-year university to enter into the healthcare field. And that's really cool about this opportunity that we're bringing to you and any friends that would be interested in signing up for this EMT program. So with that, I'm going to turn the mic per se over to Dustin so he can speak a little bit more and you'll hear more from the folks at DMACC for the rest of our programming here tonight. Thank you.
Thank you, Shane. My name is Dustin Dickhout. I'm the coordinator of EMS and fire science education for DMACC. And kind of piggybacking off what Shane said, the reason that we think that this program fits so perfectly for the high school crowd really is to give you that foot in the door. Even if this isn't something that you see yourself doing in the long term, EMT is the program that's going to get you your first taste at what medical education is going to be like. In a little bit here, we're going to bring up some industry experts that we utilize in our program to kind of give you that 360 view of what this program could mean for you if you're a parent watching, for your students at home. But to give you a little bit of background on EMT, there are 4 levels of pre-hospital care provider in the state of Iowa. EMT is actually level 2. The EMR is the base level. That would be like your first responder. So anybody in the virtual room that has a family member, has a history of that social conscious person who likes to give back to their community and they were on their local fire department or local rescue. That would be the EMR. This is one step up in that this is the EMT basic level where you're licensed to actually transport patients in the back of an ambulance from a scene or from a car crash or from somebody's house if they're sick to a hospital. You're interfacing with physicians, you're interfacing with other allied health professionals, you're working directly with the paramedic, that top level. So this is that first, the foundational knowledge that you're going to need. And I really want to impress upon everyone who's listening here that we don't expect from our standpoint that this is the only class that you're ever going to take either through DMACC or in the healthcare field. I really want you to look at this big picture, look down the road, in that if you get this education and through your clinicals that we're going to discuss here in a second, you interact with a physician, you interact with a nurse, with a respiratory therapist. We really hope that this kind of just opens up and kind of broadens your mind at other areas where DMACC can kind of get you in touch with those programs. But We're excited to bring this program to you specifically. So the program itself is going to be instructed by DMACC staff. Everyone that your students that you would see that if you're a parent again, your child would interact with, they are licensed at least an EMT level, most of them paramedics, and I'll even say that most of them are also firefighters. This is one of those careers that we kind of look at as two camps, and really it's one career field. If you look around the metro here in Iowa, especially, you look at a fire station, you'll understand that there are fire trucks in there, but inside almost every one of those fire stations is also an ambulance. And if there's not an ambulance in that fire station, on that fire truck is somebody who's trained at the EMT level or the paramedic level. So we're going to be bringing you that well-rounded representation of what this career field really means. Myself, I will be one of the lead instructors in this first go around here at Valley. The other individual who's going to help me teach this is a full-time West Des Moines EMS paramedic. So again, just really reinforcing that every one of us was in the field at some point. Almost all of us are still in the field, and we sort of transitioned into that academic role. So on the screen here, you can see what this program is. If there was one take-home message from this particular slide, I would say that you understand that this is not a watered-down version of this course. This is the real deal. You complete this course, you meet all the course requirements, you achieve all the competencies, and at some point, if you so choose, you will be eligible to take your licensing exam through the Iowa Department of Public Health and the National Registry of EMTs. It is worth 6 college credits, and those college credits, we really want to help you understand that we would like to see individuals come through this program and then talk to our paramedic program chair, Joel Oddie, who you'll meet here in a second, the fire science program chair, Brent Conklin, to continue on in your education. And some of the things that Joel is going to talk about as far as incentives is, for some funding that's there. There's a lot of opportunity here that we are very excited to bring to high school students. So without belaboring the point, I'd like to bring up Deputy Chief Mark McCullough from West Des Moines EMS, and he's going to kind of give you we'll say the ground level perspective of what, coming out of this program, you graduate and how you can immediately get to work earning some money as you continue on your education.
Thanks, Dustin. That was a perfect segue. Just to build on that point, first, this is a really attractive program. Personally, on a personal level, I actually took my EMT class in high school and have built my career. Here I am 22 years later as a deputy chief. And that's our goal here with a program like this, is to provide a pathway into a profession where you can branch out. This gives you exposure to the other allied health fields. This gives you that foot in the door of medicine. And whether you want to take that to PA school, medical school, paramedic school, become a firefighter, this really opens the door to all of those. And I can speak as an employer. This is also a very attractive opportunity, because the job market right now is very competitive amongst employers. There are a lot of open seats, and we are in competition with each other, which is good for people entering the field, the emergency medical services field. It's really good for you guys. And what we'd like to see is people coming in at this entry level and then building their career while working. That's a very easy, very possible thing to do. And you see it's a common pathway that many of our employees take. They start as EMTs, they begin working, they learn the organization, they learn the operations of pre-hospital medicine, and then they go to paramedic school and branch out from there and earning their degrees and then advance in the organization. Really, our goal for this is to bring people into the industry and eventually replace, I'd like to see people come in through this program and eventually take my job. So, thank you.
Thank you, Chief. I want to talk about a couple bullet points here towards the bottom of this slide specifically. I mentioned before that this is not, kind of a beta version of this program. Any prospective student that would come into this program would have to follow and meet all the same criteria as your, we'll say, your traditional college student or your adult learner. Because you are at some point going to put yourself in front of the Iowa Department of Public Health, and they're going to have to do a background check, which includes fingerprints. It does feel a little bit invasive, but I just want to make sure that you understand that you are applying to become a healthcare provider in the state of Iowa. There's the second to last bullet point down there as far as the lab work, the clinical experiences. We will put you in touch with Deputy Chief McCulloch and some of his staff, and you'll be in the back of their ambulance and you'll be responding to 911 calls. We have partnerships with just about every fire department or EMS standalone agency in central Iowa, in the Polk County area, Dallas County, even as far away as Forest City. So we really do get you the holistic view of what this job could mean for you, and you're going to be exposed to the real deal. You know, it's not watching Chicago Fire on television. This is real life with real problems and real people. So I'd like to bring up the paramedic program chair, Joel Oddie, next to kind of give you some exciting news about some funding opportunities that are available for you should you hopefully decide to continue on with DMACC in education and pursue your paramedic certification.
Thank you, Dustin. I do want to first introduce myself. My name is Joel Oddie. I'm the paramedic program chair at DMACC, and I first want to clarify a little bit of terminology for you all. I think some of you are probably right now thinking an EMT and a paramedic. What is the difference? I hear these terms and I think of them being interchangeable. You can see up on your screen now, the EMT program is 6 credits. Our paramedic program, which is a paramedic is an allied health professional, a recognized healthcare professional. That program is a 12-month program done over the course of 3 semesters, and it is a total of a 44 credit hour program. So the paramedic program is the next step into emergency response that a student might take, especially if a student is looking for a career, a long career in this field. I really like the idea of having this EMT program to sort of dip your toes into the healthcare waters and see maybe what direction in healthcare do I want to go. If you think that the direction in healthcare that you want to go is in emergency medical response or in firefighting and emergency response, the paramedic program is the next step in that. We're very, very proud of our program that we're offering here at DMACC. We are producing some high quality students. They're getting hired right away. There's a tremendous amount of job opportunity for them out there right now. Because of that demand that is out there, the state of Iowa, through the Future Ready Iowa program, has established the Last Dollar Scholarship that has identified the 40 most in-demand careers in Iowa. One of those careers is the career of being a paramedic, and that scholarship is paying the entire cost of the paramedic program tuition. As a high school student, that may not sound as exciting to maybe as might be your parents. However, I can tell you to come out of school with an associate's degree education with no student debt and have the opportunity to continue working, making a good wage while you continue your education to go on to a bachelor's degree or whatever it might be, is a tremendous advantage. You can find some information about the Last Dollar Scholarship on the DMACC Paramedic website. What I can tell you about it in brief is basically that everyone qualifies. Once you sign up for that, you accept any state and federal grants that you're eligible for, and then that scholarship automatically backfills whatever remaining tuition that you have. I want to reiterate, we're very, very excited about this partnership that we have going on with West Des Moines EMS. They are truly a first-class emergency medical response agency. I live here in West Des Moines. I sleep well at night knowing that they're there, and it's a tremendous asset to you all as students to come in and be able to be trained by these guys and gals that are coming in off the street on their workday to show you the ropes in this field. For more information on this, you do have my contact information. I would love to speak with anybody who thinks that they may be interested in continuing their education into the paramedic career. And also, I want you to know that those of us that you are being taught by, we're very passionate about this. I love EMS. I have told people I hope to be doing EMS as long as I'm able to walk in some capacity or another. So we do have a passion for this. We love to do it. We love to teach it, and we'd love to have you in our program.
Thank you, Joel. The last person I'd like to bring up and to kind of speak to, we'll say the third leg of this opportunity for you would be the Fire Science Program Chair, Mr. Brent Conklin. He hails from sunny California and has taken it upon himself to join us here in central Iowa to give you what it would be to be a firefighter and a paramedic. This is kind of where he started his career. So he's going to share rather some of the elements of the fire science side of this specific career path, and how when you step foot on DMACC's campus, some of the things that we're working on in his area specifically that he's pretty excited about.
All right, Dustin, well, thank you. My name is Brent Conklin, and I am the chair of the Fire Science Technology Program at DMACC. We offer a certificate program and a degree program, 64 credit hour degree program, with the opportunity for our students to have, again, coming in with their EMT, or they can take EMT in our program, as well as the opportunity to earn your Firefighter 1 and Firefighter 2 certification. Those are pro board certifications and good in most states in the country. So you can not only earn your certification here in Iowa, as well as your associate's degree in Iowa, and then take those to any part of the country that you want to go and advance your career opportunities. The fire service is one of those professions that is unique, especially here in 2021. It's a very stable profession. There are not enough qualified applicants to meet the need nationwide. And so we are giving you that opportunity. It's a profession that offers a great wage and benefits, and also a retirement. And so you come into our program with the idea, I want to serve people, I want to serve the community, I want to be a pillar in our community. And you are learning from subject matter experts and people in the field. So that's one of the special things about a community college, is that we are all people that are either currently or have worked in the fire service. And so you are actually learning from people that are still currently doing it, from chief officers all the way down to firefighters and firefighter paramedics and firefighter EMTs. 85%, 90% of the calls we run in the fire service are medical calls. And so it behooves you to be a great EMT. It behooves you to be a great paramedic, because that is kind of our bread and butter now. But we also will train you in the skill set of becoming a professional firefighter. And that's what we really champion at DMACC, is professionalism, and to really bring up the game here. So you have my contact information. I'd be happy to talk to you and talk about the new avenues that we're creating at DMACC with fire, EMS, and fire and paramedic.
He hates talking in front of the camera, so he did a great job, though. Thank you, Brent. I'm going to turn it back over to Shane at this point. And we're going to maybe kind of move towards some question and answer time. That's good?
Yep. Perfect. Thank you, gentlemen, for everything you had to share. For the students, Walnut Creek Valley High School students who are interested in signing up for EMT, and I'm going to take a look at the Q&A, see if we have any questions in there for those who typed them in. If you contact your high school counselor, they'll be able to get you registered and signed up for the class. Just a little tidbit of information is that those of you probably noticed that it is a 2-credit course. So any prospective student who wants to take this class, it will be in the afternoon, and it will be 2 periods of the day, very much like our CNA program. And it will be on site here at Valley High School. Though it's taught by DMACC instructors will be coming on site here at Valley High School. So you won't have to commute to any kind of location, worry about transportation. But I can't reiterate enough how much I appreciate the partnership that we have with the city and DMACC to bring this unique opportunity that's in high demand in terms of the health career fields opportunity. But this is also the real deal. That's the other thing I want to emphasize is we had conversation about students enrolling in this. There will be some ambulance rides, there will be some time in an emergency room, and you don't know what you might see from day to day. It's not certainly anything like you see on TV. There will be a little bit of a reality check. And sometimes if you see or experience some things, we'll also be there to support you, because we know that would be a unique experience, certainly for anybody, let alone myself, if I were to have that opportunity. So contact your counselors. They'll be able to help get you signed up. There is, and this complete presentation will be also provided on the web as well. There is a direct link. If you know that this is something you want to do anyways, you can certainly go to the website and you can sign up directly. It will go right into the building administration and counselor's office, and they'll work with you on making sure they can fit this into your schedule. So with that, I'm going to try to stop my screen share, and I'm going to look to see if there's any questions. I don't see any questions at this point in time. As a participant out there, as you're listening, if you have a question, by all means, go ahead and type that in at this time. All right, well, I am not going to keep people for a super extended period of time. We certainly thank you and appreciate the time that you spent with us learning about this unique program that we're bringing to Valley High School and West Des Moines Community Schools. Just keep in mind our contact information will be provided on the web as well. We'll push this out so people can review it and view it later. Thank you, gentlemen, for your time. Thank you, DMACC. Thank you, you West Des Moines EMS. And we appreciate everybody who was able to come in and listen to us tonight. And thank you, Brent, for coming in and speaking as well. How could I forget the fire and science guy? So thank you, everybody. Have a wonderful evening. Take care of yourselves and your family.